Dr. Mike LeNoir, and this is the Wellness Watch.
It's time for the Wellness Watch, Black Doctors Speak series, hosted by Dr. Michael LeNoir and Dr. Donna Carey. Today the topics are COVID boosters, long haulers disease, black men's mental health and prostate cancer.
Welcome to this week's edition of Black Doctors Speak. Our co-host today is Dr. Donna Carey. Dr. Carey is a communicator, a pediatrician, and administrator. She does so many things well that I can't pinpoint her into one area. So she's our co-host today on Black Doctors Speak. So welcome, Dr. Carey.
Thank you, Dr. LeNoir. Thank you for having me.
You know, I think people are sick of COVID conversations. But
I think so too.
but you know, what's going to happen, though, is that even though we're tired of COVID's not tired of us. And
not at all.
New variant of that variant
right.
To be taking over this country. And I don't know how you feel, but I'm concerned that we're in for a rugged ride because most people think this is over.
Yeah, I agree. I think we really have relaxed our what we're doing on a daily basis. People are no longer wearing masks. They're going in and going into restaurants and concerts completely unmasked. And the requirement now only has to be that you need to be vaccinated. But does that mean vaccinated plus your booster? Does that mean just your primary vaccines, which we know are not as effective if you don't have the booster?
And I got tickets to the Soul concert. Hamilton, Joe, and
oh yes, that's gonna be great. But you're boosted. You're boosted.
Yeah, but I'm telling you, I know I'm boosted, but I'm still not quite comfortable.
Right.
I know that I want to know, just like Joe does.
Right.
I don't know if you're vaccinated, because I think that you're right. People seem to act as if this whole process is over, and you and I both know it's not.
Right.
The question is, why should you get vaccinated? We've been through that for the last couple of years.
Yeah.
Now it's why should you get a booster, and now why should you get another booster?
Right.
Well, why should you?
Well, I think you should get another booster because what we're finding out is that, first of all, the vaccines work. Right? If you look at the people who are getting sickest and who are being hospitalized and who are dying, they are, for the most part, those who are unvaccinated. So we know that the vaccines work to protect us from really serious, significant disease from COVID. But we also know that the vaccines are not working for a year. They're working somewhere between, at its peak effectiveness, right? That's what you want, is between 4 and 6 months. So if you receive a vaccine, you're protected, but then 6 months later, are you still protected? And that's what the booster does. It helps to go ahead and shore up what your body was already doing, that match your immune system, get it ready, get your soldiers lined up, ready to fight. And you want your soldiers on high alert. You don't want some of them sleepy, some of them hungry and malnourished. You want all of them on the front lines ready to fight. And that's what a booster does for you.
Yeah, and multiple boosters is not uncommon. I mean,
right.
In several of our vaccines, infants get 3 or 4 shots.
That's right.
The same thing on several occasions.
Right.
And just seem to do quite well simply because the protection seems to wane at times. And I'm just very concerned that people don't understand that once that wanes, you'll probably be protected from death and serious illness, but you're not going to be protected for infection. And I saw some studies that suggested that even if you've had the disease, you can benefit from vaccination. And so, those of you who've been vaccinated, you really need to document it. One of the reasons we need to document that is because of this whole long haulers thing.
That's right.
Why don't you tell people about long haulers?
Yeah, so long haulers, we knew early on that COVID didn't just get infected and then it left you and you were fine. We knew that the virus likes to hang out in your body. We're learning more and more that it likes to hang out in the gut. It likes to hang out in the brain. It likes to hang out in the lungs. And so long haul is those who have been infected with coronavirus, But then even after they get over that initial infection, they continue to have symptoms for weeks and months after that initial infection.
Yeah, well, it's important, I think, to document that because I just saw some things where the administration is going to start releasing a lot of funds
Yes.
for covering disability from
Yes.
not just the COVID infection, but from the long haulers thing. And
Right.
so if you haven't documented that you actually had the problem, you may have more difficulty getting access to some of the resources you need if you get the long haulers disease. But I think we want to stop talking about COVID, but we can't
We can't.
because
I'm sorry, Mike, I didn't mean to cut you off, but
go ahead.
there were, over 9 million cases, positive, cases of coronavirus in the United States. Over 9 million people got infected with this virus, and that's still counting. And the thought is somewhere between 10 and 30% of those people who get an active infection with coronavirus are going to have long COVID. So of those 9 million people, that means that there's going to be somewhere between 900,000 and almost 3 million people who are going to have symptoms after they get over their initial infection. So that means that for the healthcare system, that we have to think about those people who come in and they're still kind of foggy, they're not thinking clearly, they can't concentrate. That's for adults and our children. And we know that's going to show up differently in our children. It may not be where they can express that I just don't seem to be able to concentrate. They might be too young to recognize that. So it really is going to be incumbent upon us in the healthcare field, pediatricians, family medicine doctors, adult medicine doctors, to be able to understand long COVID and to recognize it, because people may not have the vocabulary to express what's happening to them.
Yeah, I think I had brain fog long before COVID. Maybe I better go get me a test. I think that, to digress a little bit, that I was following the COVID virus instead of it following me, because in 2019, when it first appeared, I spent about 3 days and 4 days in Times Square. Then I left there, came back home, went on a smooth jazz cruise.
Oh, wow.
Then I went to Las Vegas, where I got real sick. And I was absolutely certain that I had a COVID infection, but I got those antibodies, which is one way to tell whether or not you've been infected. And I didn't have them, but I swore I was trying to catch the virus before I knew it was trying to catch me.
That's right.
One of the things I just saw recently, and you may want to comment on this, was a film by a famous producer from Oakland named, I think his name was Frank Miller. And it talks about, the name of the film was Black Men Don't Cry. And it was talking about mental health in Black males and the fact that we don't seek help. We're not getting what we need. And we're starting to see, at least in my practice and even among just the people that I know, that the anxiety and the pressure associated with this pandemic on the backs of just kind of day-to-day issues that Black people face is really creating some serious mental health problems. And to compound that problem, we're seeing that Black men are not going for treatment, or not recognizing that they need treatment. What's been your experience?
I totally agree with that. On my show, we did a whole series for a month on Black Boy Joy, and we really talked about mental health in all stages of life, particularly for our Black men, because they're not expressive as women. Women, we cry, we tell you we're tired, we tell you we're angry, we tell you we're depressed, but men hold all of that inside. And so we really talked about, well, what does it look like for an elementary young boy to have anxiety and have stress and be depressed? What does that look like in each age group? And we're seeing that it's present, but people are not aware, and people don't know who and where to talk to. So I think finding some mentorship programs, some support groups for our young Black men. There's some great programs that Alameda County Public Health Department runs for our young Black men to kind of talk about their anxiety and their fear and their depression and their trauma, right? Our community is traumatized.
Yeah, one of the interesting things that came out of that film, everybody talks about the 3 basic issues of good health. They talk about diet, exercise, and then they talk about stress.
Mm-hmm.
Well, what came out of this discussion was that we're not raised to deal with stress. We were raised to deal with shame.
Mm.
That shame is maybe a bit more of an effective piece of our development than
Right.
stress.
Right.
Our parents, my father, he made no bones about it.
Yeah,
I mean, you did what you were supposed to do,
that's right.
and you protected yourself, and you acted like a man. Otherwise, you were just, uh, not you weren't ostracized, but I have to say he looked down on you a little bit.
Mm-hmm.
What was the
Yeah.
experience of most of the men who were in this particular there are many people like actors and people, writers, people that you would recognize talking about how they were raised. And I think shame turned out to be a much bigger issue than I thought. And as I thought back on my own upbringing, I think that really was one of the key ways in which we were indoctrinated, not in or
Yeah.
whatever fathers do. There wasn't no
Right.
sitting on the knee, you know,
Right.
and certainly there wasn't no timeout. Uh,
Right.
that was out of the question.
Absolutely out of the question. And I think that you're right. I think shame is probably a really big driver in the Black community, particularly for our men, because it's, are you good in athletics? Are you, if you're not, then that's shameful. Or are you a musician? Or are you smooth? Do you have girlfriends or do you not? All of that stuff is shameful. If you're the little boy whose girlfriend is always getting taken by the cooler dudes,
Yeah.
that's shameful.
Embarrassing too.
It is embarrassing.
It certainly happened to me more than one or two times. I tried to pretend like my feelings weren't hurt. I knew it on, but I was pretty shaken up. Especially
Yeah,
when you
my
remember,
son, he's 10. He just got his first little rejection, but he took it in stride. I was proud of him.
Don't you remember when you were in high school, how deeply you felt everything?
Yes.
When somebody didn't, you got to somebody tell you, here was the key sentence. Are you still going with so and so? Then you know something is going wrong. But I do think that we need to start to look at the issue of Black men and mental health, starting with our young men, and
Yes.
give them more of a and be more tolerant
Yes.
of the feelings that they may have, and allow them to express their feelings. Because
Yes.
it certainly was not the way my brothers and I were raised, and I
Yes.
think that we pay a price for it in many ways, in the way we raise our own children.
Yeah, I agree.
I think that film is just called, it's a whole series on Oprah, and I'll try to find the name of the series, and we'll try to get it out as to exactly how you can watch it. But it's a series of pieces on Black men in a lot of different situations. The other thing, before we talk about prostate cancer, which we will get to in just a minute, is that this whole issue of health equity has been a big deal. And the country has been much more sensitive to the issues that African Americans are sicker than other people in our society. But I believe that's about to come to an end. What do you think?
Yeah. I mean, we had the prime time, right, during the COVID, as everyone was all about equity and making sure that, communities of color had access to the vaccine and access to treatments and testing. And I feel like that is starting, like you're saying, that's starting to close. People are starting to say, well, we did all this work, we put all this effort in, and they didn't take advantage of it.
We sent you a check. We sent you a check for you to cause this whole problem.
Yeah, exactly. And I think that that's sad because, when you think about how long we have been oppressed in this country as Black people, and that in I'm over 50, and that my brother is 60, and he's like remembers in his lifetime having segregation. So it's not like the people who have to deal with the systemic oppression and racism are long gone. We're still here. And so for them to think that this little amount of little chump change that they threw at us and this, 1 year of effort to try to right the wrong is enough, is really misguided.
Even the state sprinkles a little money at these managed care, Medicare managed care programs, taking care of the sickest group of people, and expect you to deal with the social determinants of health. I just think that's kind of, unless that becomes a systemic solution, I don't think that's going to make any difference.
No,
I think it's an impossible task that they've given to some of the people that are supposed to take care of the health of the underprivileged. I think that one of the things that we've seen, though, is that the interest in this is waning. So my feeling is that health always for African Americans has to start from the bottom up. Can't wait for it to come from the top down.
Right.
I think one of the tragedies, well, not tragedies, one of the side effects of having a pandemic is that we've forgotten about the regular routine stuff that we have to do. The tests we take, the visits we need to make for ourselves and our children to the doctor about regulars, and regular screening seems to have fallen off. Immunizations have fallen off. Regular visits to the doctors have fallen off. And I think for Black people, you really need to reorganize and get into the situation where you are back in the system, you're getting the proper evaluations, you're getting the proper screening. Because I certainly don't believe that after Healthy People 2005, 10, 15, 20 failed, everything is going to succeed. And just recognizing social determinants is not going to keep you healthy.
Right. And I bet you after this pandemic, and what I'd like for them to start to gather data on, which they probably won't because we already know the answer, is, now that we're out of the pandemic in a sense, right? And that things are opening up and you can now go back and get your appointments for your mammograms and your colonoscopies. Like, what is the incidence of, breast cancer and colon cancer? I mean, I just, in my own family over these last 2 weeks, I had 2 different people diagnosed with cancer because they missed a screening last year. One missed a mammogram and this year found an invasive ductal cancer. And someone else missed a colonoscopy screening and found colon cancer. And I know that that's happening across this country, particularly to African Americans who may have missed 1 or maybe even 2 years of this screening. So I think that we really need to pay attention to it. We need to collect some data and really focus in on this, because I know that we're going to see an increase in the risk in the incidence of cancer because we've missed these screenings. And how do we get people back on track?
Well, it's interesting as we talk about that, because every week I have to do a newsletter, a health newsletter. It's called the Ethnic Health Report. Those of you who want copies of it, I'm going to give you an email address at the end of the program where you can send for that. As well as we're going to give you the some information on how to get in touch with Dr. Donna's programs and progress in that communications area. She's a wonderful show every week. But here's what I notice is the common denominator, is that every single time I look at a chronic disease, be it breast cancer or asthma or diabetes or anything else, Black people have worse outcomes. And it has nothing to do with the genetics. Nothing. It only has to do with issues that have to do with lifestyle, and it has more to do with the fact that we get there late. We live with diabetes, we live with obesity, we live with asthma, we live with signs of cancer at both ends, and we don't get the screens and we don't see the doctor soon enough. The common denominator in all of these chronic diseases is not the fact that we're genetically predisposed to that. It is the fact that we get there too late.
Right. And we do. We get there too late because so many different factors and reasons why we get there too late. But when we get there and we get there late, then we still have an impacted healthcare system. So even when you arrive late, it might take you 3-4 weeks to even complete your workup. You've already arrived late. And now because the system is impacted with can't get your studies done quickly, can't get to the pathologist to read your studies quickly, can't get to the lab to get your lab work done. And it is impacting us more than anybody else. We really have to take a look at that, the impacts of the healthcare system, what we can do in the healthcare system, and what can we do to advocate for everyone. Not everyone has a doctor in the family, right? My family is blessed because they have me, and I can vocalize and talk and advocate, but not everybody has that privilege. And we want everybody to be able to have great outcomes, regardless of who you happen to be related to.
You and I both know the system is broken.
Yes.
It's been broken for a long time. So even if you are an aware person, woke,
Right.
even if you're woke about this,
Yes,
and you want to do something, I tell people with babies, I said, now you think your baby's gonna need a dermatologist, a neurologist, you know, an oncologist, an oral surgeon. Let's make that appointment now.
right.
2 or 3 years to get
Right.
in to see these people.
Yeah.
I mean, it's just so, and it doesn't matter what system you're in,
Right.
it's still going to be a problem.
Yeah.
So you really need to start to think about getting your own system and that of your family organized, because I'm kind of the family doctor. Well,
Yeah.
well, let me just say this.
I know you are, Dr. LeNoir.
Something that's wrong. They call my wife Denise, who's a nurse practitioner. My own girls and grandchildren will not touch me if there's a medical problem. They think I'm too insensitive and I won't listen. And so they always call Denise, but they do have somebody to call. But
Right.
I get calls from all over the country from various people because they can't reach the doctor, they can't do anything. So if you realize, and we're telling you, we're taking you back to the doctor's lounge. We
Right.
know the system is broken.
Right.
And if you want to really get good health care, that you need to really start to organize your own system. And sometimes we've had programs on that, and we'll talk about that in future podcasts. The other thing that I think that we have some good news in that in some of these diseases, we're starting to see that Black people don't die, and then they say as often.
Right.
As they used to. We still lead the nation in deaths from prostate cancer in terms of percentages. For every prostate cancer diagnosed among Black people, 1 in 44 African Americans die. I mean, 1 in 26. That's 1 in 44 for every Caucasian. We are doing better. But here's what's interesting about the studies on prostate cancer. This was just released this week for the American Cancer Society. What's really interesting about this is if you take a Black person and a white person, and this is probably true of so many chronic diseases, and you treat them exactly the same, with the same test and the same treatment, in many instances, outcomes are better. And so consequently, there's still something about the system that you need to understand before you try to enter it at the last minute. And if you feel that you can skip a screen or that you can skip a symptom, I have so many of my friends who've had heart attacks and strokes who had symptoms for weeks before they actually had the acute attack. Then you have to realize once you do enter that system, that's when the struggle begins.
That's right. That's right. Yeah. I mean, I think that is interesting and great news, because so many times people say, oh, it's probably genetics why Black people do worse than, Caucasians or anyone else in terms of chronic disease. So it's good that we have studies like this to show that, no, it doesn't have anything to do with the genetics. It has to do with the treatment of that individual. And I think that part of the impact that we're making in prostate cancer and cancer in general is that we're talking about it more. And so shows like this, where we can have conversations and people can get information, is so important, particularly for our Black men, because I find men more and more now are actually listening and hearing and trying to get information about their bodies and their health. And I think that is going to bode well for prostate cancer and any other type of chronic diseases that we have. So I'm happy to hear we're making some headway. And I think that if we continue to push with shows like this, that we continue to provide information, then it's going to be even better for our community.
And that's a good place for us to stop today's podcast. There's so many things we could be talking about and we'll be talking about on a weekly basis. So we want you to join us. At the end of our program, we will have the information on Dr. Donna's wonderful communications programs that you can see once a week. She has a very large following for a very good reason. And this program is sponsored by the African American Wellness Project. Our website will be listed as well. It's aawellnessproject.org. And you may as well mention yours now, Dr. Donna.
Sure. So my show is on YouTube. The channel is called Talking with Dr. Donna. You can follow me on Facebook or on Instagram at My Dr. Donna, MYDRDONNA.
People can follow you around all kind of ways. I'm going to have to get to that point. We want to end our podcast as we always do by thanking you for joining us. Thank you for listening. We want you to share it with your friends, and you want to tell people about it. Each week we'll be here with kind of candid conversation about what's going on in health, especially related to African Americans. Remember, health is your biggest asset, so protect it.
Thanks for having me.